Hello and welcome to East GTA's Prediabetes and Diabetes Awareness presentation. At the end of the presentation, we will ask you to complete a very short quiz. Once this quiz is submitted, this will notify us that you have finished viewing the presentation, and we can then notify your provider that you have completed the program. Watch this presentation at your own pace and review it as many times as you need to ensure that you understand the information provided. For this presentation, we are going to be discussing what exactly diabetes is. We're going to talk about the complications that arise from this disease. We are going to be discussing the medications and the treatment options available. And then we're going to move to discussing how to control this disease through lifestyle modifications with diet and exercise. Starting off with, what is diabetes? Diabetes is a disease in which your body either cannot produce insulin or cannot properly use the insulin that it does produce. Insulin is a hormone, and this hormone is produced by your pancreas. The role is to regulate the amount of glucose, also known as sugar, in your blood. Blood sugar must be carefully regulated to ensure that the body functions properly. If there's too much sugar in your blood, this can damage your organs, nerves, and blood vessels. The picture off to the left shows the anatomy of where your pancreas is. So you can see that the yellow organ, basically in the middle of the body there, that is your pancreas. It sits around the small intestines and it goes behind the stomach. So why are balanced meals so important? Well, in the last slide, our goal is to regulate our blood sugar. We don't want it to be very high, but we also don't want it to be too low. And we do this through controlling our diet with balanced meals as well as exercise. Ideally, we're going to be in the narrow range of 4 to 10 for our blood sugar, which is that green strip. When we have a meal, we don't want our sugar to spike too high, and then after digestion, we also don't want it to go too low. So eating balanced meals is important so we can maintain this consistent blood sugar. Let's take a look now on when we are not maintaining that nice narrow range of blood sugar and we're consuming these highly processed, easily digestible carbohydrates. So let's say, for example, we decide to have a donut for breakfast. Well, we're going to follow this chart. Our blood sugars will go up quickly, and as quickly as they go up, look at the trend, it quickly goes down. And then we're going to get into this glucose crash range. So once our sugars are quickly decreasing, our body, as a defense mechanism, will stimulate hunger and glucose cravings to make you seek replenishment carbohydrates. So 30 minutes after you had that donut, or maybe an hour after you've had that donut, your body is going to say, hey, I think we need another donut to get our sugar back up. So it puts us in this cycle of choosing these high carbohydrate foods that are really not that good for us. And we also see here in the middle, insulin. It is released when our blood sugar goes up. And when insulin is released, it inhibits fat burning, blocks fat loss, promotes fat preservation and storage. So eating this way, we are not working on our fat storage to lose weight. We are going to see weight gain because insulin is always being released because we're snacking often on these high carbohydrate foods. So eating a balanced meal lets us have a clearer mind to make good choices and continue to eat balanced meals instead of being in this vicious cycle of hunger, glucose cravings, glucose dependence, and it will help better regulate your sugar and your weight. Now let's talk about how our blood sugar goes up and how it gets back down to normal. So when we consume food, let's start up at the top left here. So eating our carbohydrate foods, we digest, goes to our stomach, and then to our small intestines. At the small intestine level is when the glucose is absorbed into our bloodstream. So as the blood sugar goes up, our pancreas is signaled to release the insulin. And insulin helps the blood sugar get into our cells for energy. Once the sugar has made it into the cells, then if we test our blood sugar again, we'll see that we're back down to a normal glucose level. Let's talk a little bit more about how our sugar goes from the bloodstream into the cell. So insulin is absolutely mandatory for our body to get the sugar from our bloodstream into the cell, and we can see how it does that with these pictures. So the first picture to the left, we can see that there is an insulin receptor. The insulin molecule will go into the receptor, which opens the glucose channel. Once the glucose channel is open, then the sugar can flow from the blood into the cell for energy. I added this slide here to just make the point that insulin is literally the key for glucose or sugar to get out of the blood into our cell. Without insulin, your blood sugar will stay high and the glucose remains in your bloodstream. Another point I wanted to add was the importance of muscle. So muscles can take up to 6 times the amount of sugar or glucose than our other cells due to their energy requirements. So therefore, with more muscle mass, you can better regulate your blood sugar. Every muscle movement requires a great amount of energy, so the more that you move, the more energy or glucose you burn. And then the chart here, so the first 3 columns are adipose tissue, so different fat cells, and then the last column is skeletal muscle, just showing that it takes up more glucose, so it gets that sugar out of the blood, and therefore you can regulate your sugar a lot easier. Moving to just the summary of metabolism. So again, we eat our carbohydrate foods, which is our sugars and our starch. Then our body will change it into glucose or sugar. The sugar will then get from our bloodstream into our cells with the help of insulin, and then that's how our body gets our energy. Let's move on to talk about why we would develop diabetes. Type 1 diabetes, this is an autoimmune disease. This is also known as insulin-dependent diabetes. People with type 1 diabetes are not able to produce their own insulin and therefore cannot regulate their blood sugar. They need to depend on insulin injections to keep their blood sugar at a normal range. Roughly about 10% of people living with diabetes have type 1. This is a form that usually is diagnosed in childhood or adolescence, but some cases it can show up in adulthood. Type 2 diabetes is the more common diabetes. So people with type 2 diabetes cannot properly use the insulin their body makes, or their bodies are not producing enough insulin to regulate the sugar in their body. And roughly about 90% of people living with diabetes have type 2. Type 2 usually develops in adulthood, but we're seeing more commonly earlier diagnosis, and it can happen in our children. Type 2 diabetes can sometimes be managed with healthy eating and regular exercise alone, but may also require medications or insulin therapy. Now, when I'm talking about your body not being able to use the insulin that it does produce, what I'm referring to is insulin resistance for type 2 diabetes. Insulin resistance is when the cells in your muscles, fat, organs, they no longer respond well to insulin and can't easily take up the glucose from your blood. To compensate, your pancreas will make more insulin to help the glucose into the cells. And if your pancreas is able to make enough insulin to overcome the cell's weak response to insulin, your blood sugar or your blood glucose levels will remain normal. Now looking at the two pictures, the top picture is a normal cell. So all of those purple structures are your insulin receptors. They're all working, and so there isn't a backlog of sugar in your blood. Whereas the insulin resistant cell, you can see that only two of the receptors are working. So all the glucose molecules, all those red little dots, there is a backlog because there's not as many receptors working to get the sugar from the bloodstream into the cell. Okay, so now that we have an understanding of what diabetes is and what's going on in our bodies, I want to discuss diabetes risk factors. So there are several different reasons why someone may develop diabetes, and the cause of diabetes depends on your genes, your family history, your ethnic background, and other factors such as your environment and your health. And the picture to the left, we can see that there are non-modifiable risk factors as well as modifiable risk factors. So things we actually cannot change and things that we can. So things like our family history, our age, our race, our ethnicity, and a history of gestational diabetes, things like that we cannot change. But things we can change would be how physically active we are, our weight, our blood pressure, and our cholesterol. I would like to direct you to this website here. So this is a Government of Canada website, and there's a quiz on this website where you can find out what your risk is for diabetes. So you go through a couple different pages. I believe there's 11 different pages, and they're going to ask you your gender, your age, your height and weight, lifestyle questions. And at the end or the bottom of each page, it has a Did You Know segment. So for example, the first picture here, how old are you? And you put your age. And did you know as you get older, the risk for diabetes increases? So it has small amounts of information on each page to help educate you, and at the end it gives you a score. So if you're very high and you have not yet been diagnosed with diabetes, this is an opportunity to print it out and bring it to your healthcare provider, begin the discussion around diabetes. Or let's say you have diabetes but you have family members that haven't visited the doctor in a while and you want to see what your risk is. You can direct them to this website and they can go through the test to see if they're high at risk. And if they are, then it's recommended that you go and get some blood work done to see if you have diabetes or prediabetes. So let's just quickly go through what makes you more at risk for developing diabetes. So again, your age, if diabetes runs in your family, if you are of certain ethnic backgrounds, which they're all listed there, if you are already pre-diabetic, if you had gestational diabetes during pregnancy and or gave birth to a baby weighing over 9 pounds, if you have a history of heart disease, so history of heart attacks, strokes, mini strokes, and or you have high blood pressure, if you have kidney, nerve, or certain eye conditions that are associated with diabetes, if you are overweight and or carry excessive weight around the belly, so if you are apple-shaped instead of pear-shaped, you're at a higher risk. If you have problems with cholesterol, either your good cholesterol levels are low or you have high triglycerides. If you are a smoker, if you're diagnosed with certain conditions, so they're all listed there, that for some reason puts your likelihood of getting diabetes higher. And then lastly, taking certain medications like steroids, they're all listed there, but that increases your risk as well for developing diabetes. Let's briefly touch on other forms of diabetes. So as mentioned in the slide before, gestational diabetes. This kind of diabetes is a temporary form of diabetes that occurs during pregnancy. Between 3 to 20% of pregnant women develop gestational diabetes, depending on the risk factors. And a diagnosis of gestational diabetes may increase the risk of developing diabetes later in life for both mother and child. So what happens with gestational diabetes is that high blood sugar levels in the mom brings extra sugar or glucose to the baby, and that causes the baby to put on some extra weight. And then prediabetes is a condition where your blood sugar levels are higher than normal, but are not yet high enough to be diagnosed as type 2 diabetes. And although not everyone with prediabetes will develop type 2, many people will, so that's why I put a caution diabetes ahead sign there. Let's move to the diagnostic criteria. So for prediabetes, it would be if you had a hemoglobin A1C of 6 to 6.4. The HbA1c is also sometimes just referred to as your A1C. The fasting plasma glucose between 6.1 to 6.9. And then for diabetes, you would have to have a A1C of 6.5 equal to or greater, and or a fasting plasma glucose of equal to or above 7. And then lastly, for gestational diabetes, this is diagnosed if you have a positive oral glucose tolerance test. So this is a series of 2 blood tests. The first one is fasting. You're given a syrupy glucose solution to drink, and then 2 hours later, your blood is taken again. And this is just a test to see how your body metabolizes that sugar. And if you fail that test, you have gestational diabetes. For people with diabetes, there are routine tests that are recommended to be completed regularly, and this will help you manage diabetes and prevent future complications. So the hemoglobin A1C blood test, this test measures your average sugar, and you want to monitor this at least once every 6 months. So if you are a controlled diabetic or you're pre-diabetic, 6 months is sufficient. If you are an uncontrolled diabetic or a new diabetic, then it's usually recommended every 3 months for your hemoglobin A1C. This test is a 3 to 4 month blood sugar average. So it's not just a snapshot, it's an overall average, so it's a good tool for your healthcare provider to see how you're managing your diabetes. Next is the LDL blood test. This is the measurement of your bad cholesterol, and this should be checked at least annually, once a year. The eGFR, also known as the estimated glomerular filtration rate, and or your ACR, which is your albumin creatinine ratio. These are tests to see how your kidneys are functioning. The retinal eye exam, so this should be done once a year, and this test helps us understand if diabetes is affecting your eyes. An annual foot exam, so we're looking for breakdown of the feet, so little cuts, ulcers, anything like that. We're looking for fungus, we're looking for your sensation, we're looking for your blood flow, so things that diabetes can affect. Your feet are one of the first places that complications can arise from, so that's why we really encourage you to make sure you're checking your feet, you're following up with your healthcare provider regularly, and just making sure the whole goal is to prevent any complications. And lastly, it's important to monitor your blood pressure regularly, especially if you're on high blood pressure medications. Don't just blindly take your medication because the doctor prescribed it. Blood pressure is always changing. You may need more medication, you may need less medication, so routine follow-ups are very important. If you haven't had any of these tests or some of these tests done, please discuss it with your healthcare provider so they are completed for you. This here is a picture of a lab requisition for blood work. So I'll just quickly go over what I believe is some of the good tests to do at least once a year. So starting at the top, the hemoglobin A1C, done every 3 to 4 months or up to 6 months depending on your diabetic control. The kidney function, the eGFR, sodium and potassium, especially if you're on blood pressure medications, the ALT and ALK-Phos, these are liver enzymes, so if you have diabetes, you have an increased risk of fatty liver disease, so an elevation, especially of the ALT, could indicate a fatty liver. the lipid assessment. So this tells us your good cholesterol, bad cholesterol, triglycerides. So that should be done at least annually, or if you've had a change in cholesterol medication. Next, these are 2 urine tests here, the albumin-creatinine ratio, so that one is for the kidneys, and a urinalysis. And over in the next column we have the CBC. This is a complete blood count. It tells us about your hemoglobin, your red and white blood cells, your platelets. It's just good to do maybe once a year, or if there's no history of problems, that could be maybe deferred every couple of years if you're younger, but as we get up in age, that should be done at least annually. And then in the last column there, under other tests, you can see B12. So the most common medication that most diabetics are started on is called metformin. And for some reason, metformin can alter, I believe, your gut bacteria. So the absorption of B12 can be a problem for some people, and we see lower levels of B12 in some of these patients. So we like to monitor that at least once a year, or if you're trending lower, monitor that more often to see if you need a supplement or changes in your diet to bring your B12 levels up. Next, I want to talk about the targets for diabetic management. So for our A1C, our hemoglobin A1C, for diabetes to be considered controlled, your value needs to be at 7 or under. Your fasting glucose, so if you took a blood sugar before you ate, we want to see that range to be from 4 to 7. If you monitored your blood sugar 2 hours after eating, we would expect to see your sugar between 5 and 10. If it's much higher than that, then we definitely need to reevaluate what you're eating and the portion sizes. And lastly, if you have an A1C above 7, then we're going to have stricter parameters for you. We're going to ask that 2 hours after you eat, when you test your blood sugar, the range is from 5 to 8. Moving to targets for cardiovascular protection. So people who have diabetes, you have a stricter guideline for blood pressure. We want to see your blood pressure less than 130/80. So not 135/85, not 130s over 80s. We want to see you in the 120s/70s or lower. For the LDL cholesterol, this is your bad cholesterol, we want to target this number under 2. And some doctors are a little bit more strict depending on your overall health and may target a 1.8 or a 1.6. So just make sure you know your own targets, because it might be stricter than what's listed here. Let's quickly review how to monitor blood pressure at home. So if you don't have a blood pressure machine for home use, it is highly recommended to invest in one. Diabetes is a chronic disease, and blood pressure monitoring is something that we're going to be asking you to do lifelong. When you're in the office, your blood pressure might be a little bit higher because it's not the most relaxing environment. So the best thing to do is monitor at home when you're at rest. So there's certain factors that can change and alter your blood pressure. So if you are in pain, if you have recently ate or drank something, if you smoked recently, if you were just talking to someone. So we want to make sure we go sit in a quiet environment for about 5 minutes before we start monitoring. When we do start monitoring, we want to make sure we're in a chair with back support, feet flat on the ground, not crossed, and you are in front of a table that you could rest your arm on, where the top of the blood pressure cuff is at the level of your heart. Your palm is faced towards the ceiling. When you monitor your blood pressure, you want to take more than one reading. The first reading is usually falsely elevated. So once you take your blood pressure, wait a few more minutes. Don't walk up anywhere, talk to anyone. You just stay seated, and after a few minutes pass, you take your blood pressure again. If there is a drastic difference between the first reading and the second reading, for example, the first reading was 150/90 and the second reading a few minutes later was 130/60, make sure you take a third reading or even a fourth reading if you're having these differences. You might not be at your resting blood pressure yet, and it's very important that we report our resting values to our healthcare provider, because those are the numbers that determine your treatment. Treatment options. The goal of diabetes management is to keep blood glucose levels as close to your target range as possible. We do this through lifestyle management, so dietary and physical activity, and the recommendations are to eat a balanced, healthy diet and also exercise at least 150 minutes of aerobic exercise a week and have 2 days of strength training per week to maintain or build your muscle mass. If you remember from slides previously, the importance of having more muscle mass to control your blood sugar. And then if lifestyle management is not enough to control your diabetes, then we have medications that can help us control. And these medications are available in oral form and also injectable. For type 1 diabetes medication, we have insulin. So as you remember, type 1 is insulin dependent. These people do not make their own insulin and so have to give themselves multiple injections of insulin a day. In addition to the insulin injections, treatment would also include carb counting as well as fat and protein, so counting your macronutrients, monitoring your blood sugar frequently, eating healthy balanced foods, and exercising regularly to maintain a healthy weight. For type 2 diabetes medications, there are more options available besides insulin. Historically, the first line treatment is metformin. If you don't tolerate metformin or your sugars are not being controlled with metformin alone, then we move on to adding or changing to a different medication. So it's important when you're choosing the next medication to pick something that has added benefits. Some medications only bring down blood sugar. They don't do anything else. But some of these medications have cardiovascular protection or renal protection, kidney protection. And I think that's very important because the end stage of diabetes, complications could be heart failure or kidney failure. So having that extra protection on board is important. And then lastly, insulin can be used for both type 1 and type 2 diabetes. It's not just for type 1 alone. If your sugar levels cannot be controlled on these medications listed here, then we could move to insulin to try and control your blood sugar. And another thing would be if your kidney function is very low and your body's not able to clear oral medications, then we would switch to insulin for safety. Some medications that we may be on when we're diabetic on a normal day are kidney protective for the most part, but some of them can hurt our kidneys if we're in a severely dehydrated state. So if we're sick, we're having vomiting, diarrhea, some medications might need to be put on hold until you're able to eat and keep down fluids and food again. So some medications would be pain medications, some diabetic medications, some blood pressure medications, over-the-counter anti-inflammatory pills, so those be very careful with. And so not every single blood pressure, not every single diabetes medication, so I want you to go to your healthcare provider and ask which medications would need to be put on pause for your individual needs, and then you just pause those for a few days when you are sick and then resume them when you're feeling better. The disease process of diabetes, so if you have normal blood glucose levels but have the genetic disposition of diabetes, 30 to 40% of these people will go on to develop prediabetes. And the people with prediabetes, 30 to 40% of them will go on and develop diabetes. And it's very important to note that both prediabetes and diabetes, there could be short and long-term complications. So we're going to discuss that next. Complications of diabetes can affect our body from head to toe, as indicated in the picture to the left. Short-term complications could be low or high blood sugar levels, low referring to hypoglycemia, and high is called hyperglycemia. Long-term complications could be starting with cardiovascular disease, which can lead to heart attack and stroke, retinopathy, which could lead to eye damage and blindness, nephropathy, that could be leading to kidney failure, neuropathy, that causes nerve damage and could lead to amputation. And diabetes-related complications can be very serious and even life-threatening. So properly managing our blood sugar levels will reduce the risk of developing these complications. The lower our sugar levels are, the better. Going back to our short-term complications, just to get a visual of what hypoglycemia looks like, so low blood sugar. So if your blood sugar is too low, so usually symptoms, you might start feeling them if you get to a blood sugar level under 4. You would first start feeling hungry. That's usually the first sign of lower blood sugar. And if you ignore that, it could progress to feeling shaky, sweaty, dizzy. You can have confusion or difficulty speaking. You can feel very weak or tired, have a headache, or feel very nervous or upset. Moving to the opposite side of the scale, and we're going to talk about hyperglycemia, so high blood sugar. And you can notice here that some of the symptoms of low sugar and high sugar are similar, like hunger. Other symptoms of hyperglycemia could be extreme thirst, feeling very sleepy, frequent urination, having dry, itchy skin, blurred vision, and also slow wound healing. The next 2 slides, I'm just going to review some stats to let you know how detrimental diabetes is on the body. So diabetes, we know, increases the risk of high blood pressure, narrowing of our arteries, and coronary artery disease and stroke. People with diabetes are 3 times more likely to die of heart disease. Diabetes contributes to 30% of strokes. It is the leading cause of blindness, 40% of heart attacks, 50% of kidney failure requiring dialysis, and 70% of all non-traumatic leg and foot amputations. So it is just so important that we keep our diabetes under control. Here is a picture of a diabetic foot, so what we may be looking for on a foot exam. So you can see that there could be ulcers that form, dry and cracked skin. We are usually concerned about that because bacteria can make a little home in the cracks and cause skin breakdown, leading to infections, reduced blood flow, nerve damage, bunions, ingrown toenails. So we just highly encourage that you make sure you follow up with your annual foot exams. In addition to your healthcare provider doing their foot exams, we also want you, especially if you have diabetic neuropathy, to do your own foot exams. So if you can't see the bottom of your foot, you get a mirror. You always make sure you check your shoes for any sharp like stones or anything that could be in your shoe that could cut your skin. And make sure you are cleaning your feet and moisturizing them daily. And if you do see a problem, you follow up with your health care provider in a timely manner. And lastly, I just wanted to show you a picture of a diabetic eye. So diabetic retinopathy is a possible complication. To the left we have the healthy eye, to the right we have the diabetic eye. So the diabetic eye, what the eye exams are looking for are abnormal blood vessels, aneurysms, hemorrhages, cotton wool spots. So this concludes my presentation portion. I'm going to be handing it over to our dietitians to walk you through the importance of diet and lifestyle changes to control your sugar levels.
There are lots of lifestyle factors that can help with managing prediabetes and diabetes. In this portion of the presentation, we'll be talking about the roles of different macronutrients, some different diets that can help with blood sugar management, as well as physical activity and overall lifestyle management. First, we have a question for you. Is it true that eating too much sugar causes diabetes? What do you think? The answer is false. It's a tricky question though. Type 1 diabetes is not related to sugar intake, and in type 2 diabetes, excessive sugar intake can contribute to weight gain, which is a risk factor for prediabetes and type 2 diabetes, but it's not a direct causal relationship, as there are many other risk factors as well. If you're at a higher body weight, losing 5% or more of your weight can improve high blood sugars. And we'll talk about some dietary strategies that can help you manage your blood sugars as well as your weight. In order to understand dietary strategies for prediabetes and diabetes, let's take a look at the basic building blocks of food, macronutrients. Macronutrients include carbohydrates, proteins, and fats, and these are the components which provide us with energy. First, we'll start off with the macronutrient protein. Protein is found in meat products such as poultry, pork and beef, fish, beans, lentils, eggs, tofu, cheese, nuts, and seeds. An average person needs about 0.8 grams of protein per kilogram of body weight. For example, someone weighing 150 pounds or 68 kilograms would need about 54 grams of protein per day. Most protein foods do not raise blood sugars if consumed in moderation. So that's a good thing to keep in mind for those of you who are watching your blood sugars. Fats is the second macronutrient here, and fats do not raise blood sugars either. However, they are high in energy, and too much energy intake, whether that's from fats, proteins, or carbohydrates, can contribute to excessive weight gain, which can make it harder to manage your blood sugars. There are two types of fats, saturated fats and unsaturated fats. Unsaturated fats include canola oil, vegetable oil, olive oil, grapeseed oil, non-hydrogenated margarine, as well as fats from a lot of plant foods such as avocados, nuts, and seeds. Fatty fish are also good sources of unsaturated fats. It's recommended to choose unsaturated fats more often, as these contribute to better heart health. Saturated fats, on the other hand, are often found in butter, coconut oil, hydrogenated margarine, palm oils, lard, cheese, processed red meats. It's recommended to choose these fat sources less often, as they have a tendency to raise your blood cholesterol levels. In terms of carbohydrates, you might be familiar with the idea that carbohydrates raise blood sugars, and that would be correct. Most carbohydrate foods are digested into sugar, and they do raise blood sugars. Some common sources of carbohydrates include grains and starches, including foods such as pasta, cereal, baked goods, as well as starchy vegetables like potatoes, yams, and corn, fruits, including dried fruits and juices, dairy products except for cheese, legumes like beans and lentils, as well as sugars are all sources of carbohydrates. Carbohydrates can be split into three main categories. Sugars, for example, simple sugars like table sugar, honey, or maple syrup. These foods tend to raise blood sugars quickly. So it's recommended to limit your intake of sugars for those of you who are watching your blood sugars. Starches come from a variety of foods, as we discussed earlier on the last slide, and the impact of starches on blood sugars vary. To figure out which starches are best to consume, keep watching this webinar and pay particular attention to the glycemic index section of the presentation, as the glycemic index talks about which starches are more easily digested and tend to raise blood sugars, and which starches are less easily digested and tend to help keep your blood sugars nice and even. Fiber is another type of carbohydrate, and it doesn't raise blood sugars because it's not digested in your body. It also helps to improve satiety and regulate blood sugars. So it's recommended to include sufficient amount of fiber in your diet. There are two types of fibers, soluble and insoluble fiber. A healthy diet contains a mix of soluble and insoluble fibers, as they perform slightly different tasks in your body. Soluble fiber is found in foods such as oats, barley, nuts, seeds, beans, legumes, and some fruits and vegetables. It's also found in psyllium, a common fiber supplement. So in your body, soluble fiber attracts water and turns into gel during digestion. This slows down the digestive process, helps slow down the absorption of sugar into your body, and may help lower the risk of heart disease. Insoluble fiber is found in foods such as wheat bran, vegetables, fruits, and whole grains. Insoluble fiber adds bulk to the stool and helps to regulate bowel movements.
After learning about different nutrients that our body needs, we will be now moving on to the next section, where we will be talking about different dietary guidelines to manage our blood sugar levels. In this section, we will be discussing about Canada's Food Guide, Handy Portion Guide, Glycemic Index, Vegetarian Meal Pattern, and a Low Carbohydrate Meal Pattern. Canada's Food Guide. Canada's Food Guide plate model recommends eating a variety of healthy foods each day. This includes eating plant-based foods more often and choosing a highly processed foods less often. When using a 9-inch dinner plate, making sure half of our plate should consist of a variety of colorful vegetables and fruits. The other quarter of a plate should consist of whole grain foods, such as whole grain pastas, breads, brown or wild rice, quinoa, whole grain oatmeal, hull barley, bulgur, etc. The other quarter of the plate should consist of protein foods such as legumes, nuts and seeds, fortified unsweetened soy beverage, fish, eggs, poultry, unprocessed lean meats including wild game, lower fat dairy products such as lower fat milk, yogurt, kefir, or lower fat, lower sodium cheese. Also making sure water as our first choice of the drink over sugar sweetened beverages or juices, and importantly, limiting highly processed foods such as frozen entrees, cookies, hot dogs, bacon, etc. Handy Portion Guide. When planning a balanced meals along with the Canada's Food Guide plate model, our hands can be a very useful tool in estimating appropriate portions. When planning a meal, use the following portion sizes as a reference guide to measure different food groups. To start with, for example, grains and starches such as whole grain pastas, breads, quinoa, rice, or whole fruits such as apple, pear, oranges, choose an amount the size of your fist. When measuring vegetables, choose an amount as much as you can hold in both hands. It's important to choose brightly colored or rainbow colored vegetables such as bell peppers, zucchini, kale, spinach, beans, broccoli, etc. When measuring meat and alternatives such as fish, lean meat, poultry, eggs, cooked lentils, legumes or beans, choose an amount the size of your palm and the thickness of little finger. When measuring fats such as cooking oil, or non-hydrogenated margarine, nut butters, or butter. Limit the amount to the tip of your thumb. When measuring milk and alternatives, drink up to 1 cup or 250 ml of a low-fat dairy product at each meal. Glycemic Index Food Guide. The glycemic index or GI is a value used to measure how specific carbohydrate containing foods or beverages can increase our blood sugar levels after its consumption. Foods are classified as low, medium or high glycemic foods and ranked on the scale of 0 to 100. The lower the GI of a specific food, the less it may affect your blood sugar levels. Low GI diet can help improve blood sugar control, improve LDL cholesterol levels, and reduce cardiovascular disease risk. In this slide, grains and starches as well as fruits are ranked based on their glycemic index value. For example, when choosing grains and starches, choose whole grain products with the GI value of 55 or less. When choosing fruits, some examples of low GI fruit include apple, pear, pomegranate, berries, oranges, etc. This slide talks about the glycemic index of various protein-rich foods. For example, milk and alternatives as well as plant-based beverages. Also, meat and alternatives. Since everyone's digestive system and insulin production is different, their glycemic response will also be different. Therefore, responses to various foods can vary from person to person. For example, orange is listed under the green or low glycemic index food category. Someone may digest it quickly and it can still spike their blood glucose levels very high. That's why self-monitoring blood glucose is very important. Since glycemic index does not take into account the serving size or portions for different foods, these are some of the easy tips to integrate into our day-to-day eating when planning a meal. Choosing of fresh fruits over a canned in a syrup or juices. Choosing a whole grain breads instead of a white breads. Cooking pasta to a just done consistency versus until very soft or mushy. Adding a bran buds or all bran cereal to your breakfast. Eating beans or lentils or any other plant-based proteins more often, and so on. Vegetarian diet. Vegetarian or vegan dietary pattern can help improve blood sugar control, blood cholesterol levels, as well as reduce the risk of heart attacks. People following vegetarian dietary pattern can consider protein sources such as beans, lentils, tofu, tempeh, nuts and seeds, eggs, or dairy products such as yogurt, milk, cottage cheese. One needs to be mindful that beans and lentils does contain small amount of carbohydrate as well as protein. Thus, person can consider having half of their plate with beans and lentils and remaining half of the plate with vegetables. Low carbohydrate diet. Studies on lower carb diets in people with type 2 diabetes show improvement in hemoglobin A1C levels, reduced insulin requirements, and less variability in glucose. Some studies also show higher rates of type 2 diabetes remission, improved triglyceride levels, and a reduced need for medication in the short term. However, long-term effects of following low carbohydrate diet is still under review. There may be changes in recommended blood sugar monitoring and medication adjustment. This may involve your healthcare provider recommending enhanced blood glucose monitoring, adjusting medication that may cause hypoglycemia, and ensuring adequate intake of fiber and other nutrients. Thus, before you decide to start on low carbohydrate diet, be sure to discuss this with your diabetes healthcare team. You may wonder, how many grams of carbohydrates should I have in a day? Answer is, it depends. Recommendations vary. Very low carbohydrate and high fat diet restricts total carbohydrates to 50 grams or less per day. This means higher intake of saturated fat and a total fat. This can negatively impact our blood cholesterol levels. Low carbohydrate diet allows 50 to 100 grams of total carbohydrates in a day. versus moderately low carbohydrate diets allow up to 130 grams or less total carbohydrates in a day. Consider your personal goals and what you can realistically manage in the long term before starting on a low carbohydrate diet. When counting carbohydrates, be sure to deduct the fiber from the total. For example, a medium apple or an orange has about 19 grams of sugar and a 4 gram of fiber. The total carbohydrate count would be 19 grams minus 4 grams is equal to 15 grams of available carbohydrate. When following low carbohydrate meal pattern as a way to healthy eating, consider using plate method. Cover half of the plate with non-starchy vegetables and the low glycemic index fruits. The remaining 1/4 of the plate each would cover the sources of protein foods as well as healthy fats. Some examples of vegetables and fruits would include non-starchy vegetables such as kale, spinach, zucchini, bell peppers, cauliflower, tomatoes, cucumbers, or some fruits such as berries, kiwis, orange, peaches, and many more fruits that can fit into a moderately low carbohydrate diet. When talking about healthy fats, consider choosing avocado, nuts and seeds or their butters, olive oil, or other vegetable cooking oils. When talking about protein foods, consider incorporating eggs, low-fat, low-sodium cheese, meat, especially the lean meat, fish or seafood, tofu or tempeh. If following a moderately low carbohydrate diet, 1 to 2 servings of carbohydrate containing foods can still fit into each meal. This would allow one to have 1 slice of whole grain bread or approximately half cup potato or a half cup brown rice per meal. After discussing different ways to healthy eating, you may wonder which diet controls diabetes best. The answer is there is no special or one diet that controls diabetes best. Work with your diabetes team or a registered dietitian to find ways to incorporate balanced meals, controlling portion sizes, ways to incorporate regular physical activity, as well as making necessary lifestyle changes are best way to control diabetes. Also, consider limiting processed foods such as sugar-sweetened beverages like soda, sports drinks, or packaged pastries and baked goods, refined grain products such as white breads, sweetened fruits, or processed meats such as sausages, hot dogs, bacon, etc. You may be curious about new or fad diets. Oftentimes, fad diets are extremely restrictive, also hard to maintain, and may lead to difficulty maintaining a certain weight. Sustainability is the key to success. Start with lifestyle changes you will be able to maintain over your lifetime. Consult with your registered dietitian or a diabetes care team before you start on any new diet.
When making food choices, reading the nutrition facts table can help you figure out which items are better for blood sugar control. When reading a nutrition facts table, start at the top and check the serving size. If you're having more or less than this amount, you'll have to adjust the nutrition values accordingly. Next, check the calories. As a rough guide, an adult needs about 1,500 to 2,500 calories a day, depending on gender, body size, age, and activity levels. The other nutrients that we want to look for are saturated fat, sugars, cholesterol, and sodium. We want to limit these items as excessive intake can be harmful to our health. In this case, we see that this item, 1 cup, has about 22 grams of sugar, which is about 1/4 of a person's recommended daily sugar intake, which is quite a lot. Next, we also want to look at the amount of fiber and the amount of protein that this item provides. You see that here there is no fiber and 2 grams of protein, a little bit of protein. So not a lot of fiber and not a lot of protein. If I were a person with diabetes, I think this is probably something that I would maybe have half a cup of so that I'm limiting my sugar intake. take a look at these 3 food labels from 3 different brands of crackers. Press pause if you need more time. We're going to be taking a look and trying to figure out which ones are better for us from a nutrition perspective. So when we're comparing food labels, we want to start at the top to check the serving size, and you see that they're similar across all 3 brands. It's 20 grams per serving. In terms of calories, they're also similar. A is slightly lower at 70 calories, whereas B and C both contain 90 calories per serving. We see that compared with A and B, option C is higher in total fat as well as saturated fat. And we want to keep in mind that saturated fat is one of the nutrients that we want to limit. We see that all 3 items have a similar amount of carbohydrates. And you'll also notice that A is higher in fiber and lower in sodium compared with options B and C. So given this information, which one of these crackers would you choose? A, B, or C? Personally, I would go with option A because they are higher in fiber, lower in sodium, and lower in fat compared with B and C. And these were the 3 brands of crackers that we were comparing. So Ryvita is a brand that I often recommend for patients with prediabetes or diabetes. Another similar option of crackers is called Wasa, and they have a similar nutrition profile. When we're grocery shopping, it can pay off to take some time to compare food labels between different brands, as there can be some pretty significant variations in terms of the amount of fat or sugar that you're getting from brand A to brand B. You should also be aware of food claims on packaging. For example, just because an item claims to have no added sugar doesn't mean that it's sugar-free. 100% fruit juice, for example, don't contain any added sugars, but they are still high in sugar from the fruit, and they will still raise blood sugars. Other sugar-free items, for example, chocolate chips, may still be high in calories or fat, so take your time when grocery shopping and gather all the facts needed to make an informed choice. Next, we'll switch gears a little bit and talk about exercise in diabetes. When you exercise, your muscles will use sugars from your blood for energy. If you exercise regularly, insulin sensitivity may increase, meaning that your body doesn't need as much insulin to lower blood sugars. This way, it helps to lower your overall blood sugars even more. Some benefits of physical activity include improved glucose control, which we talked about, weight loss and weight maintenance, decreased insulin resistance, improved lipid profile, including LDL cholesterol and triglycerides, improved blood pressure, and it can help reduce the dose or the need for diabetes medications. If it's been a while since you've been physically active, start by limiting the amount of time that you are sedentary. Depending on your fitness level, you might start with 10 to 15 minutes of light aerobic exercise, and if possible, work your way up to 150 minutes of aerobic exercise a week. Examples include walking, and you can walk outdoors or indoors at home with the help of follow along videos. Other aerobic activities like biking, jogging, and swimming all count towards your quota of 150 minutes a week. In addition to aerobic exercise, it's also recommended to participate in resistance training, 10 to 20 minutes 2 or 3 times a week to work all the major muscle groups. Some examples of resistance exercise include weightlifting, push-ups, sit-ups, and squats. And remember, just a little extra activity each day can go a long way.
The ABCDs of living with diabetes. Follow these basic steps to protect your health. A stands for A1C or hemoglobin A1C. Monitor and control your blood sugar levels. People with diabetes are encouraged to keep their A1C level under 7. B stands for blood pressure. People with diabetes should aim for blood pressure readings under 130/80. There might be individualized targets set by your doctor based on a history of cardiovascular health. C stands for cholesterol, especially LDL cholesterol levels. People with diabetes are recommended to keep their LDL cholesterol levels under 2. D stands for drugs or medications to decrease the risk of heart disease. Your doctor will determine the need to start the medications such as blood pressure or cholesterol lowering agents based on the risk factors associated with diabetes. E stands for exercise and healthy eating. Work with your diabetes team or a registered dietitian to set and achieve individual nutritional as well as physical activity goals to best manage blood glucose levels. The first S stands for self-management support. Learning to check and monitor blood glucose levels, including hypoglycemia management at home. It might be different for different populations. People with diabetes who are on multiple daily injections need to monitor blood glucose levels 4 times or more. They might use a continuous glucose monitoring system. People with type 2 diabetes, depending on their medication regime, may need to monitor their blood glucose levels 2 times or more every day, versus people with prediabetes usually does not need to monitor blood glucose levels at home. The second S stands for screening or monitoring for complications. Discuss with your doctor regarding health of your heart, feet, kidneys, and eyes. Typically, it is done once a year or more frequently based on the complications associated with diabetes. The final S stands for stop smoking. Smoking cessation is one of the most important things people with diabetes can do to help prevent or delay the onset of complications associated with diabetes. Thank you for listening. Now you can access and complete self-assessment quiz. Link can be found in your email. Once completed, please email us at egtafht1@gmail.com with your name to receive a participation certificate. Once again, thank you for your participation. If you have any follow-up questions, please sign up for our Q&A session focusing on prediabetes, diabetes, and kidney health, facilitated by our registered nurse and a dietitian. If you need individualized support with one of our dietitians, social workers, nurses, occupational therapists, physiotherapists, or the groups that they offer, please give us a call at 647-693-7401. You can also learn more about the exciting programs that they offer by visiting our website under Calendar section. Before we wrap up, we would love to hear from you. If you have 2 minutes, please share your valued input to help us improve our workshop. You can click on the link attached in your email to access post-workshop survey. We look forward to hearing from you. Once again, I would like to thank you for your participation and interest in our diabetes workshop.